Good evening everyone and welcome to tonight's recruitment webinar. My name is Sally Thomas and I'm a former MSF field worker currently working in the Sydney office in the field HR department. I've been working with MSF for just over 7 years. I started off as an architect, technical referent and then a project coordinator in the field. Tonight I'm joined by two special guests. Next to me I have Robin Sands, who is the head of the Field Human Resources Department here in Sydney. Welcome, Robin.
Thanks very much, Sally.
And you also started off in the field with MSF.
Did, yes. Started off in the field in 2005. I was an engineer. I worked as a logistician, project manager, worked in headquarters as well, and now here in Australia.
Welcome.
Thank you.
And we are also joined with Jean-Christophe. Welcome, Jean-Christophe. You are the Operational Communications and Media Manager here in the Sydney Australian office.
Good day, Sally. Thanks for having me.
Welcome. Okay, so tonight's webinar we will be discussing general recruitment for all profiles for international staff that here in the Australian office that we send overseas into the field. We want people to help them to better understand what it means or what it's like to be an international field worker in the field. We will provide some examples, some statistics. We will be looking at the profiles, so the different types of people that we do send to the field and some of the recent changes. And we will look at the essential criteria and the desirable criteria that we look for in all recruiters. But first, we would like to share with you a short film, and this film gives you a clear picture of who is MSF and a little bit about our principles and our charter.
Dans 24 heures à Haïti. Ici, à l'hôpital des Tabards, nous prenons en charge 1500 patients par mois.
Wearing this T-shirt means that we all engage to follow certain principles laid out in MSF's Charter.
The principles of independence and impartiality are actually our strongest security measures. So when in the field we are wearing this T-shirt, in a way we are protected because people know that we are outside of the conflict.
Médecins Sans Frontières provides impartial help without discrimination and independently of any political powers. We are neutral and we do not take sides in conflicts. We treat our patients with dignity and respect for their cultural and religious beliefs. Impartiality is essential. We treat each patient on the basis of medical need, not on any other criteria. 90% of our budget comes from private donors all over the world. This generous funding gives us freedom to independently choose our actions without interference from political and economic powers. Our work in emergencies often leads us to speak out publicly to highlight forgotten crises, to mobilize other aid organizations, to draw attention to weaknesses in the aid system, to demand access to people trapped in conflict zones, or to campaign for fair access to essential medicines for all. Wearing an MSF T-shirt means being part of a worldwide medical humanitarian organization that speaks out freely and acts with total independence.
So as you can see, MSF, we're a very large organisation and we have been around for more than 40 years and we continue to grow every year. In 2015, MSF, we had 446 projects in 69 different countries around the world. And as you can see from this map, there is a concentration of our projects in Africa, the Middle East and Central Asia. It's not only important to understand the countries where we work, but also the context of where we work, and that has a huge impact on the type of medical care that we provide in the countries where we work. In 2015, as you can see, 29% of our interventions were in countries considered to have armed conflict, and 45% were in a stable context. Robin, can you outline for us in a little bit more detail what do we consider to be countries with armed conflict and maybe those that are in stable contexts?
So yes, just about half of our projects are in unstable contexts. But unstable can have a wide range of levels of what that means, but often it's due to political instability, countries with some areas that are in conflict, or a post-conflict country with tension. I mean, some examples of this currently, certainly for conflict rather than instability, Syria, Iraq, Yemen are currently countries in conflict. And unstable countries might be considered at the moment a bit more South Sudan and Afghanistan, which used to be in conflict but now is unstable or post conflict.
Constantly changing.
Constantly changing, yes. Yeah. South Sudan is the good example of that. It was post conflict, and it went back a bit into conflict, internal disruptions. Another one would be Central African Republic as well. Recently in conflict, now is somewhere between as well. Libya is another example. But also many of our projects also in stable contexts. Mm-hmm. Usually the stable contexts are to do with a particular medical need, epidemic or something like that. For example, HIV or TB is very common in more stable projects, and they're more long-term projects, so they need to be they tend to be in more stable countries to be able to sustain them. Some examples of that are Malawi, Sierra Leone, Uganda, and Tanzania currently with refugees, a lot of refugees in Tanzania.
Huge displacement around the world at the moment.
Yeah. And therefore another example of that, in fact, we're in countries, Italy and Greece as well, with the refugees coming across from the Mediterranean. Yep. But whatever the context, the projects are designed specifically to meet the needs of the most vulnerable people. But we need to adapt the delivery of our aid to those different contexts, and that's what's the challenge.
Yeah. And MSF being a medical organisation, of course, our focus of our interventions in all those countries, no matter if it's conflict, post-conflict or stable, it's providing medical support to the most vulnerable populations. JC, can you describe for us what are some of the main medical interventions that MSF focuses on in different countries around the world?
Well, as you and Robin have been mentioning, as in 2016 and 2017 still, one of the main contexts of intervention of Médecins Sans Frontières is in conflict area. So the needs of our patients are related to both the direct impact of this conflict, and they would suffer injuries, physical injuries, they would suffer trauma mainly. So we would have in these countries high medical intervention with surgeons, with anesthetists, with general practitioners, emergency doctors, OT nurse, and all these people would work in addressing the needs of our patients in terms of surgery, in terms of emergencies, but also in terms of rehabilitations. And this is the case, for example, in Syria, in Iraq, and quite interestingly, also in terms of post-operation, post-intervention and rehabilitation, like in our major hospital in Amman in Jordan. And we are also addressing the consequences of this conflict. If we look at Borno State, for example, we are not only treating patients with injuries, but because of the conflict in Borno State in the north of Nigeria has impacted the population since more than 2 years now. People have fled their fields, they couldn't harvest their crops, they lost all their cattle, so there's no food basically, and there's no more economy and no food in circulation. So there is a major problem in malnutrition, especially with children, and our teams are treating thousands of children suffering from malnutrition in northern Nigeria.
And also, we will often, maybe in situations like that or other places around the world, we have mass vaccination campaigns, especially against measles. We were mentioning before non-communicable diseases in many places.
Yeah, because one of the impact of conflict, but it's also an impact when we are facing natural disasters, is the health system is broken, which in a country where the health system is already weak, or there could have been a good system, like it was a functioning system in Syria and Iraq, but because of the war, the health system has collapsed. So children have stopped being vaccinated against measles, and we have to be able to protect them. We have to be able to prevent children from being affected with these communicable diseases. So we are also treating these consequences. And as you were mentioning, all the non-communicable diseases like diabetes, For example, in Yemen, and it could be surprising because the idea we have from Yemen is a country in conflict, so we think we do war surgery, but we don't do only war surgery. We treat lots of patients who don't have access to insulin, and it's very important because it's a life-threatening condition.
Yeah.
And we have to be able to provide them with these services in Yemen, along with treating malnutrition, but also providing, and maybe we don't always know that about MSF, with non-medical item, as we call. So we would provide displaced population with shelters, with blankets, with buckets, everything for a family life to be able to be organized.
Exactly. Anything that might then affect the medical or the health needs of the population. So these discussions, there's the medical interventions we do, there's so many complexities looking at the context and the medical needs of the people, the existing governments and what's in place. And there's thousands of staff all around the world that make this work happen and make it possible. And as we can see from this graph up here, only 8% of those people in the field are international staff, like ourselves, that have gone to the field. It's around 84%, that was back in 2015. They were all the local national staff, as we say. And the work that we do, it's impossible without all of them. And I think one of the main aspects then of the international staff that we send to the field, I'm sure you'll agree, is that they need to have good supervising and management skills and maybe also background in certain training in their expertise to be able to capacity build on these national staff.
Because the national staff also cover all the same profiles of the international staff. They're doctors, they're surgeons, they're anaesthetists, they're administrators as well.
Yep. Exactly.
And it's important for an emergency medical organization like Médecins Sans Frontières to be able to prepare also the handover of the project, the handover of the project to national authorities, to national staff. And that's why, for example, in countries that have been either lacking medical staff or being disrupted by the war, like in South Sudan, MSF in Awil Hospital is connecting to the wall. It's a city in the south of Awil, hospital and nurses school to train nurses and to bring more nurses into medical practice.
Yeah.
Yes.
And as we can see up here as well, the breakdown of the staff that we send to the field, we have 23% are medical, 32% are nurses and paramedical, and a huge 45% are non-medical. Robin, do you want to explain some of those categories a little bit more for us?
Sure, certainly. Medical, under that category, you need doctors, anaesthetists, surgeons, medical scientists, and then, of course, specialists. So many more specialists are required these days, and also in our work as well. So for us, the particular interest are paediatricians and specifically female obstetricians in talking about the right access for the context that we work in. Female obstetricians are required. In fact, female doctors or female staff are often required, only able to work in particular countries and context. For nurses and other health professionals, at the moment, mental health activities are on the increase. Currently, our pool of nurses is at capacity, and so therefore we've got a high criteria for professional nurses. But with nurses with particular specialist skills, neonatal nurses, paediatric nurses, those are definitely need.
Language skills.
Language skills always the useful language skills are French and Arabic, are very useful skills. So those all add to your skills. And then of course major importance management, as you mentioned before. Management and supervision experience really can make that difference.
I've quite a few times when I've been to the field and come across nurses that have been sent to the field and they're purely there to train all the other nurses there on the ground. So they're not seeing any patients, anything like that. They're there to purely upskill and train the staff, especially in South Sudan, where the education system there is so broken that the skill level of some of the national staff can be very basic. So we really need to build up on that
Absolutely.
capacity.
And to actually think of that, therefore, on the management skills, hospital managers are actually a requirement,
Yep.
and with that very high level of management and organisational skills as well.
Yep.
And plus, as always, previous experience working in remote areas or
Yep.
low resource or developing countries as well is another critical skill that adds to your opportunities. Yep.
Okay.
Then on the non-medical, well, as you saw, it's 45% the support staff that allow medical staff to actually do their work, and we need all the support staff we can get from finance, human resources, logistics, a whole range of technical side of logistics, WhatsApp, and any others I missed there, finance, admin, HR.
Yep.
Yes.
As we said, they just get all the stuff done, do all the things, so the medical staff can concentrate on medical interventions.
Yes.
So talking on from that, we've got, they've touched briefly on the essential criteria that we have for all professions. So there are some criteria that are very specific for different profiles, but for all people that are considering to go to the field, this is a list of essential criteria for all professions. And as we've been talking about, we send only professionals to the field, so that's why you need to have a minimum, very, very basic minimum of 2 years. Whatever your profession is, you need to have had 2 years experience in that profession. Once again, the supervising and management skills, and having a commitment of time. You need to be able to go to the field for approximately 9 to 12 months. There are some specialists which it's a bit more flexible, but the majority of the people, we really need that commitment of almost 1 year. One of the bigger changes that we've got in our recruitment this year is that in the non-medical field that we now are recruiting field communications managers. Jean-Christophe, this is your area. You work in the communications department here in Sydney. Why do we have comms people in the field?
Well, basically because communications is an integral part of MSF operations. For example, when I was in Nairobi a few months ago, I visited the Mathare program of MSF. Mathare is a huge slum suburb of Nairobi where there is a huge problem of sexual violence.
Yeah.
And MSF has a clinic there that is addressing the needs of the patients suffering this condition of sexual violence, having been attacked quite often by people in the community. So communications in this instance is supporting the operations with reaching out to the community, with spreading out the word and messages that the suffering of the patient has to be respected, it has to be recognized. MSF has services that are free, accessible to everyone, that identity will not be disclosed, patients will be protected. And it's very important to be able to use all communications tools, whether it's radio, whether it's street theater, whether it's billboards in the streets, in the community centers, to be able to talk to the community at large about this issue and the challenges that the victims are going through.
And what would you say are the main objectives and key responsibilities for this new role?
It's quite wide, quite demanding, because this new role will be dealing, for example, if we look at Central African Republic, we have a context, as you were mentioning, Robin, where we are in a situation of post-conflict, with still a high level of violence in the country. So it may happen that our medical facilities, our ambulances could be attacked by different armed groups. So in this situation, for example, the field communications manager would have to work with the rest of the operational team to think about how can we address to the population through radio messages or through affiche posters in the streets to explain what is MSF, that we are a medical humanitarian organization, that we are independent, neutral, treating everyone. And if you attack our hospital or our ambulance, you will put our patients in danger, you will put our staff in danger, and we will not be able to provide medical services to the whole population. So to do that, the communications person would have to be able to have a strategic vision, to develop a strategy on a whole country. It will be, he or she will have to be also operational, like being able to write a press release, to prepare his head of mission for an interview, which means do media briefing, to have also the capacity to sometimes animate a Twitter account, like we have MSF South Sudan
So
or
really
MSFC.
across all different types
It's
of
very,
communications platforms.
all across the board, capacities in terms of communications.
So what are some of the main skills and experiences that you are looking for these new recruits?
Yeah, we are certainly looking for people having already at least 2 years or more experience in terms of communications, in terms of journalism, also public relations. It would be a key also to have an experience overseas in context in Africa, in the Middle East, or in Asia. It would be a major plus to have had an experience in another non-governmental organization, and to have, I mean, the will to go there.
Yeah, it's a big point. Willingness to go almost anywhere. Yeah.
And also, maybe it's not a skill in itself, but patience, sense of humor, flexibility,
adaptability,
diplomacy,
Yeah.
capacity,
Stress management.
capacity of negotiation is super important.
Yeah. Okay. All right. So we've been talking a lot about, some of the global numbers and general recruitment, but we know that this evening our audience is most probably majority Australian, New Zealanders, and we wanted to look at some of the statistics from 2016. So we can say that in 2016 we sent 203 field workers out into the field, and 51 of those were new recruits. Looking at the list up there now, that's looking at over the past 3 years, the top 10 countries where Australian and New Zealanders were sent to the field. Just looking at that, we can see that South Sudan has been at the top for the last 3 years, which is obvious due to the conflict and the constantly changing context there, and also with as we're saying, the low-skilled local workers. So unfortunately, we do need to send lots of expats to that setting. Also, Robin, we've got Iraq sitting there at second as well. There was a lot of activity in Iraq last year.
Yes, there has been, but the interesting thing from this is you can see across the years how much the departure of our field workers is really dependent on what's going on in the world at a given time, and you can see the main ones coming and going, and everything you can see there is in world news of conflicts and difficult situations around the world.
Yep.
Yeah. And I mean, an interesting point to note from that is the majority are not sent to the classic Africa, despite most of our MSF projects being in Africa. You can see where they are from that list, and many are, as you can see, for Australians, are in the more higher security context as well.
Which is a very important point to raise, I think, with when you are being recruited with MSF and the first time you get deployed, as we're saying, the flexibility and adaptability, we as an organisation, we don't have that luxury to pick and choose where we're going to send, especially first missioners. So everyone needs that willingness.
And you can see also the link to communications through this list of countries, because it's either countries where there is a high level of coverage from the media, either countries that we would report as underreported crisis. And this is where it's very important that we have good and reliable communications team in this country to be able to talk to the media locally, but also to be the interface with international media. And we were lucky, for example, in Australia in the recent years, to have been able to have foreign correspondent reporting the only documentary to date on Kunduz attack in Afghanistan, a major documentary on Yemen, and to have also Sydney Morning Herald journalists coming and witness the difficulties of the South Sudanese people and how MSF is addressing their needs.
Yes.
No, it's very important.
And just on that too,
Yeah.
just thinking about that also for the placement of our first mission,
Yeah.
first departures, is it's very much based on the context, the need of the organisation responding to the populations we respond to. That's what defines where we send people, rather than a particular. Everybody's got a particular preference, but our response is based on need.
And I'm currently working, within the recruitment team at the moment, and one question I often get from people is that it's, with the Australian passport, are we restricted on places where we can go? And we're actually, Australia and New Zealanders, we've got probably one of the most flexible and best passports to be able to go to many of those countries we were talking about, and unrestricted movement to many places. So we're extremely lucky.
Yes, no, we are lucky because it is. You get to work in some amazing contexts with some amazing people and do some great work that's very satisfying. Yeah,
we were sharing some stories before about. JC, you were saying some people that you've spoken to coming back from Yemen and the experiences they had there.
Yeah, it's quite interesting. As communications, we have the possibility, and we are quite lucky to talk and brief and debrief the field workers before they go in the field or when they return. And when we talk with medical and non-medical staff coming back from Yemen, all the people are really attracted to that country and they want to return. And we have several field workers who have achieved 2, 3, 4 assignment in Yemen, and they fell in love with that country, with that population, basically.
Definitely. Yeah, and one other aspect, I've spoken to quite a few females returning from Yemen and other areas in the Middle East, and they've had to be completely covered, and it hasn't been a problem. They've said that some of the national staff that they've worked with have been some of the most lovely people that they've ever met. Last year I was in Iraq for 9 months, and it was the community aspect there was just phenomenal. They welcomed us, with so much. They were so warm in their welcoming all the time, and the skill of the national staff, it was amazing.
Yes.
Yeah. So another aspect that we wanted to quickly touch on tonight was also the possibility of having a career within MSF. We're not an organisation that's just about sending people to the field one-off and things like that. All of us sitting at the table tonight, we've been working with MSF for quite a while. As I was saying before, I started off in logistics, went to coordination roles in the field, and now in the Sydney office. Yes. How about you, Robin?
Yes, kind of the same. In fact, I'm actually an engineer in electronics, and joined the organisation as a logistician, moved off into project coordination, then actually into logistics coordination. I worked in the main office of Paris, but in human resources, very closely related to project coordination, a lot about managing people and teams. Yep. Back to the field again as project coordinator, and then coming to Australia here as the head of human resources. So a huge variety of options and careers and paths available for people depending on your interest, the challenges you want, and there are many opportunities in the organisation.
And you've now been working here in the office, the Sydney office,
yes,
in the field HR department for a while. You probably would have seen some expats coming through the office many yes, times. Are there any that stand out?
We've got so many wonderful field workers who commit to work overseas, yep, but there's one particular one I always think of. There's our longest serving is Hella Poulsen Dobson, who's done over 30 placements now. I think she's on the 31, in fact, to be exact, in projects all around the world
yep,
in so many different roles. She was a nurse by by trade at the start, and she's been head of mission, managing whole countries and multiple projects in countries. She's been a medical coordinator, looking after the technical medical stuff. She's done emergency responses, and she's all done so many different times.
Yep.
And she's just returned from Nigeria, I think in Borno State, doing the emergency there. So she's always one that comes to mind. She's fabulous, and she's continued that life between home and the field.
So she picks up work in Australia and then goes to the field. And that whole balance.
Yes.
And if you want to know more about Helle, you can go to msf.org.au and you can look at the interview we did, and she was very very available, very nice to share some very stories about her job in Borno State.
Yeah, which is a good point. I mean, our website, tonight we've got a webinar which will stay up on our website. There's lots of interviews on our website. There's a lot of information there about all of the essential criteria for all the different profiles. So really very much encourage people to continuously go to our website to see if they believe that they would be a good fit for MSF, because MSF is not for everybody. But we're always on the lookout for skilled professional staff. Our criteria is continuously changing, so we do update our website to keep it up to date with, as I was saying, the new, comms wasn't there a few months ago. It is there now. A couple of years ago, we didn't recruit so many mental health officers, but that's on the increase. So it's continuously changing.
Yes, I think in paediatrics and neonatal as well, expanding specialised roles as well. So.
Yep. All right, well, we'd like to thank everybody. Have we got any questions? A few that have come in that we have seen through. So, people always want to know how long will they go for? Golden question. Robin, how long will they go for?
How long will they go for? Well, it's we ask for a commitment of 9 to 12 months because that is the length of time that most people will go to the field for on their first mission. Sometimes a little bit less, but with time to get into the field, being available and stuff, the 9 months is the minimum.
Yeah. Okay, but it's all, sometimes there are some short missions, there are some longer ones as well, especially once you get into a coordination role. I was just speaking to a field worker today, and she will be going out for 1 year with maybe a commitment of 2 years in the one position.
Yes. And you have to think beyond that first mission. It's a career. There are many other opportunities, whether it's shorter or longer, depending on your interests as well.
And also another aspect that people are always wanting to know a little bit more about are the salary or the payments or any financial benefits of being a field worker?
Sure. So MSF takes in charge all costs because we want experienced, competent staff to go to the field to work. So we provide a salary per month, a monthly salary for your time in the field. We provide travel, visas, accommodation in the field, food. We cover all the costs so you can arrive in the field and start your work to help the vulnerable population. Yeah.
And what about partners? So on your first departure, no, there are no opportunities with the first departure of the field for partners. But if you continue with the organisation, yes, there are possibilities of going to the field with partners. They're limited, and they're limited also therefore on context that has to be in a country that is either stable. If you've got a family with children, it has to have medical facilities, schooling, and these sort of things as well. So they are possible, but usually further down the track. Exactly. As we're talking about with the career progression it's not always easy to facilitate it, but we do look into it to try to retain staff, when and where we can.
Yes.
Okay, well, I think that's about all. Okay, well, thank you everybody for listening in tonight. Any of the there have been some more questions that have come up, so we will be answering those in the next couple of days directly onto the website. And as we were just saying, please continue to go to the website if you've got any queries. Hopefully some of them can be answered there, or there's other platforms there that you can be asking for assistance to try to get a better idea. But I'd like to thank Jean-Christophe and Robin for joining me this evening. And to everybody watching, I hope we were able to answer most of your questions and queries, and that we have maybe generated some interest amongst listeners, or those of you who might think you might have friends or family that would be interested to work with MSF in the future.
We would be happy to recruit lots of communication people.
Okay, thank you and good night.
Thank you.